This is the Mind Body Detox Podcast, where we discuss all things integrative health and wellness, interviewing folks from all over the world, sharing insights and wisdom on how to live a healthier life in mind, body, and spirit. You guys are in for a treat in this episode. I get to interview my colorpuncture and esogetic medicine teacher, Rosemary Bourne. And in this topic, we're going to dive into color and light, and also talk a little bit about acupuncture and how that's connected to colorpuncture. We're going to talk about some fascinating studies regarding the mind-body connection, including trauma and chronic pain and how those are connected. How we use light and frequency already, and how that's being used in mainstream medicine, and then connect the dots for you regarding colorpuncture and how we use frequency and light in this amazing, innovative, cutting-edge modality. And lastly, we'll cover the science of biophotons and how spirituality and religions have spoken about light throughout the ages. And finally, we'll talk about the power of having our own personal experiences with light and frequency. I hope you enjoy part 1 of this episode on color puncture. Welcome back to the Mind Body Detox Podcast. I'm your host, integrative intuitive medium, Kara Lovehart, and I'm here with a very special guest and one of my teachers and instructors, Rosemary Bourne. And today we're going to talk about esogetic medicine and color puncture. So first off, Miss Rosemary, I would love to have you share with our listeners a little bit about your background and what you do. And then we'll go into the amazing esogetic medicine and color puncture. I'm so excited for this topic.
Well, thanks, Kara, for having me and for inviting me, and also for being a great student of mine. So I began my healing journey very, very young, in my early 20s. How I got into alternative medicine was I started studying macrobiotics and Shiatsu, so Japanese acupressure massage. And I worked in a macrobiotic healing clinic. There was acupuncture and different types of Shiatsu massage and Oki yoga, which was a type of Japanese yoga. So it was an incredible job that I was fortunate to get. And then from there, I went on and studied Chinese medicine. I got interested in and exposed to Chinese medicine. And then in my late 20s, I've always been interested in meditation and consciousness as a part of my healing inquiry. And I went to India and I was studying different types of meditation techniques. And I was working in a healing clinic in India with a particular community. And Peter Mandel was invited down to that community. And so Peter Mandel is the creator of this esogetic aculight therapy that I teach and practice. And because I was already an acupuncturist and I was participating in, doing sessions in that ashram, I was invited to this seminar with this German naturopath, Peter Mandel. And the seminar was a huge hit with that community because of his ultimate focus on consciousness and awareness and orienting people to their path, to whatever their unique path is. And so I started studying, and that was in the late 80s. And I had certain very compelling experiences using the work, and I kept going. And then when I came back to the West, I came to America first, and with my former partner, we set up this institute, this Esogetics Institute in the US in 1993. And we've been teaching seminars all over the US since that time.
So I remember my very first class with you and how life-changing it was, because it not only took a lot of these concepts I'm already aware of with this holistic approach of how everything's connected, but it took it further, including, blood work and the physical body and function, but also beyond into this consciousness piece that I was just hooked. And so for people who are listening, who like this podcast is for people who are really getting really jazzed up about holistic medicine and integrating things and learning about them, some of the listeners may not even know a little basic, I guess, education or description or understanding of what Eastern medicine and acupuncture really is and how that may relate then to esogenetic medicine. So I would love for you to give us a little explanation for that. And then let's create a bridge here and connect them and tell everyone about what esogenetic medicine and color puncture is, because it's just, you guys, this is the most amazing thing. I think if you're like me, a lot of people, our listeners, are really excited about going deep. That's our listeners. So you're going to really love this. So tell us about Chinese medicine and acupuncture and how it's different from Western medicine.
Right. So, first of all, let me tell you a little bit about esogetic colorpuncture. So, it's a system of colored aculight therapy, which combines theoretical principles of Chinese medicine with modern discoveries about the physics of light. So, that those modern discoveries around the physics of light take us a little step further than the energetic approach of Chinese medicine into more a study of the quantum light field. So the creator of Esogetics, as I mentioned, his name is Peter Mandel, and he's a German naturopath and acupuncturist, and he created this system around 45 years ago now. And he recently stated that he focuses his understanding of illness through the findings of psychiatry, neurobiology, neurophysiology, and physics. And as I'm sure many of your listeners understand, since the 60s, we've made a huge move forward in terms of our understanding of the brain and the mind-body connection. And I think we're going to talk about that a little bit later. So in terms of making a comparison between the way Chinese medicine works with the body and the way esogetics works, I'd say that there are many similarities. So for example, in Chinese medicine, a very core concept is that we treat the root and not the stem. So we understand that when people have an illness, they have a series of symptoms. So in Chinese medicine, your therapeutic approach is to try to look what is the locus or the cause, where's the real source of that illness that's generating all those symptom complexes, because otherwise you can run around trying to give supplements to 10 different symptoms, but in a sense, you're not addressing the underlying adrenal insufficiency that's driving that pattern. In Chinese medicine, you'd call that kidney yang insufficiency. So in color puncture, we have a very similar saying, but we speak it more from this quantum holographic approach. We say that everything develops from the subtle, so some kind of disharmony in the information field, and that subtle block affects the energy, and then this leads to changes in the matter of the body. So those two approaches, treating the root and not the stem, or understanding that everything develops from the subtle to the coarse, are quite similar. Both operate from the perspective that physical illness and pains are important signs that there may be deeper disharmonies in the psyche and the spirit. And these lead to these disturbances in the biocommunication between the cells. I think it's just a question of an energetic approach as opposed to a quantum field approach using light as opposed to using acupuncture needles.
Yeah, and so when it comes to the color puncture, you're affecting the information field and you're utilizing the meridian points as well, similar points that acupuncture needles use, correct?
Exactly. So Peter identified through certain Russian research that acupuncture points are perfect portals for light and the introduction of light into the system. They did certain tests where they used gamma radiation to track the movement of light in the body, and they found that it was moving along acupuncture channels, these subtle body channels in the body that have now been understood as part of the primovascular system through an allopathic lens. So this perivascular system, they now feel is probably an allopathic way of describing acupuncture meridians.
And so with the meridian points, and for people who are still like new to Chinese medicine in general, I know that with these meridians, they are connected to the emotions as well. And that kind of goes into the mind-body piece. But for those who are new to the mind-body connection, before we go deeper here, because this is we have this as a foundation, how do you explain the connection between emotions and physical symptoms? And can you give us maybe a few examples that you've experienced in your practice?
Yeah, or I can give you some interesting examples from different researchers that I think will
Sure.
explain this. So, firstly, from the traditional perspective, the connection between the mind and body has always been very deeply understood. So, all traditional medical approaches like Ayurveda, Chinese medicine hold this understanding, Tibetan medicine. And then what happened was in the 1960s, a bunch of research started to happen around the brain and the whole field of neurophysiology and neurobiology. And what they started to understand was that we have different levels of the brain, and the limbic brain, the specific study started to happen in the limbic brain. And what they started to understand was that responses to stimuli always happen in a cluster: behavioral, emotional, perceptual, and somatic. So this was a very beautiful delineation of the mind-body connection and how imprints from these reactions are stored in the brain. So let's say you have a very scary event happen. First of all, from the body side, you'll have a somatic reaction. You might feel nauseous. And then in response to that somatic reaction, you might make an emotional and a perceptual connection. And this is somewhat dependent on how your brain's been conditioned by a previous similar experiences. But so you have a nausea reaction, you feel scared, your perception is I'm in danger, and then you might have a behavioral reaction where you feel like I need to get out of here. So this might just be having a difficult conversation with your partner. So they started to understand that this is how they started to understand that talk therapy doesn't really work, because in talk therapy, you're processing what's already conditioned. So this is called semantic memory. It's connected more with the prefrontal cortex. The higher cortex is where we make meaning. So in order to create change, we need to drop down into the stem brain, the instinctive brain, and then especially to depotentiate those clusters: behavior, emotions, perception, and the somatic body. This cluster that gets activated. So just to give you some interesting, other concrete examples, there's a man called Dr. Robert Shea, and he's written a book called The Body Bears the Burden, which is specifically studying chronic pain. And what they discovered was that sometimes when a person develops chronic pain, the first thing is it usually doesn't develop without the emotional experience of feeling helpless at the time of the injury. So that the pain is overcoupled, the injury that causes the pain is overcoupled with the experience of a sense of loss of control. So, for example, race car drivers who expect to have injuries often don't develop chronic pain, nor do drunk drivers. So, this then they started to understand that the chronic pain, sometimes the injury is no longer there in the scan, but that limbic brain has taken over the pattern and starts to recreate it. So they start to see that especially the emotional valence is a very important part in the brain recording that pattern and then getting into a negative loop with it. So just one other, because I think it's so interesting, this mind-body dynamic. There's another woman, Judith Herman, who wrote a book called Trauma and Recovery. So she studied sexual abuse victims and vets returning from war with chronic trauma. And so just a small example of one of the sort of signs they'd notice is people who've been sexually abused often have this strange restless leg syndrome at night. And so they come because they've been using magnesium and and not to knock supplements. Supplements can be very helpful, but it's not working. And then what they discover is it's this behavioral, emotional, perceptual, and somatic bundle that's been programmed and recorded in the amygdala and the hippocampus that keeps getting activated by cues in the environment.
As you're saying that, I'm thinking about all the restless leg clients that I've worked with. And so, and from my perspective as my way of working with people is through many different types of assessments now as I've gained these different modalities. But my whole, again, reason for entering into color puncture was as a medical intuitive, I see patterns in people's auras. I see this information. I've always experienced it and going, hey, there's something going on here with trauma, that you keep re-traumatizing the system, that your restless leg is coming up. So it was really validating you're saying that, because some of the things we would work with is, again, trying to down-regulate the nervous system. Even before I met you, that was like a thing. And I know that some of these people were utilizing magnesium and other things and medications and they weren't working. And I knew that these people had been through trauma. So it's really interesting. I'm going to check that book out. For those of you who are listening to, we're going to put all of the books that Rosemary's listing in the show notes. So if you want to access them as well. But that's really interesting, Rosemary.
Yeah, Robert Shayer, if you want to really go deeply into this dynamic between pain and the subconscious imprinting, he really talks about it in depth. It's a great book.
So I'm glad that you shared some of those examples for people, because that's just really specific too. And I think that's really helpful for people to kind of understand that when people talk about the mind-body connection, I still feel we're in this place right now where we're still trying to, for some people, give them evidence. And I think that it's really solid, because we're in this, we are bombarded with information. You're gathering information, new studies and research that you're always learning. As practitioners, we're in it. But for the layperson, it's really something that sometimes I have people that come to me that still say, I think I'm a believer in the mind-body connection, and I always think to myself, it's not a really matter of belief at this point, but they just don't have the information yet. So I think this is really valuable for people to have that. So I want to kind of drop into the color puncture and using light and frequency. And this is really a main modality used in esogetic medicine, but some people may still maybe feel it's very alien to use light and frequency. It may seem a little bit, like, are you gonna wave some magic wand on me? So I know that we do commonly use frequency and light in our mainstream medicine. So just people just aren't aware. So can we talk about some examples of that, and then move into talking about light and frequency and how it's used in color puncture and esogetic medicine?
Yeah, I just want to make one comment before we move on, is that I think that in order for people to understand, it's most important that they have an experience. So for the people that are listening, just practice checking those 4 things. The next time you feel you're in a very stressful situation, first of all, check in with your somatic body, your sensory body. So if you're feeling stressed, where are you feeling it in the body? Is your heart kind of scrunching up and feeling really tight? Is it the back of your neck? So that's the somatic body. What emotion are you experiencing? What's the perception you have from that? And as an outcome of that, what's the behavior? Because that's the mind body cluster, and that is the somatic experience. So I really want to encourage people to understand that they can track that within their own bodies. And just by tracking that, they can depotentiate the activation.
Absolutely.
And then, of course, do a few out breaths. Long out breaths through the mouth also will bring down the high sympathetic response. So that's, I think, experiencing is believing, and that's a way they can experience right now. So in terms of light, it's very interesting because, yes, light and optical techniques have made really profound impacts on modern medicine. Many of you have probably experienced the use of lasers, and especially in optometry, you go to have your eyes tested. That little red light you're looking at is a laser. And so light devices are being used in clinical practice, in allopathic medicine, to assess health and treat disease. And so some of the, interesting ones are photonics with nanotechnology. Most of your watches run on nanotechnology, but also biomaterials and genetic engineering. So I was looking at this one review, and they're describing applications of light in imaging, diagnosis, surgery. I saw one beautiful study using a beam of low-level blue light going in to work on parts of the brain. So it's a very exciting integration of light medicine into contemporary allopathic medicine. And what's great about it is it's non-invasive and it's extremely hygienic, because you don't even need to necessarily touch the body. You don't puncture the skin. So then in our contemporary type of disease environment, this can be very efficient.
We don't recognize a lot of times that we are affected by these lights and these frequencies around us. It's very common for people to not have that awareness. Although a lot of our listeners and a lot of people that we work with they're self-proclaimed highly sensitive, or they say they're very empathic, or their just nervous systems are more aware of that stuff. So those people have had those the experiences of light and frequency for themselves.
Yeah, well, definitely I know that in allopathic medicine, they're especially using the two ends of the spectrum. They're using infrared laser, which has a very deep depth penetration, and they're using blue light. And blue light and infrared UV light can especially be used for antibacterial effects as well. So there are many applications that are now happening. I saw one study talking about dental work, using laser for dental work. Again, much more efficient and less likely to break a tooth via drilling. Use of blue light for MRSA, these type of very serious skin conditions.
Well, over COVID, that was the big thing where people then all of a sudden on the market, you saw everywhere UV lights for sanitizing everything and sanitizing your phone and all that. So that's kind of an application of what you're talking about there with the UV and antimicrobial, antibacterial properties of using it.
Yeah. And I think this is great because then people don't have to feel that it's either or, that, I like an integrative approach. So the way Peter Mandel views it, he describes allopathic medicine as the explicit medicine. So we're looking at the body, the material aspect of the body, rather than the informative energetic level. And, we're running the blood work. And that's important. We need to know the hard data about the matter of the body. And then we use these, what they describe as implicit medicines, to help with the generation of the conditions that might cause disease. So actually, if you use both approaches, you get a much more powerful wave of healing. So I think that's important. So we also use UV light to work on the subconscious. So you see, it has an explicit and an implicit activity. And I'm a great believer in a non-dual approach to everything. So
Yeah.
we integrate everything. We don't throw anything out, but we see what's important in a particular context. Definitely, we need lifestyle and energetic approaches to mitigate disease. And then when something's really serious, you need to run the blood work. You maybe need a surgery.
Yeah. Absolutely. And I second that. It's something that's I think is very important because we do have this space where collectively we are wanting to now, I think there's a move and a shift to wanting to now address things from a root cause. And I think just like initially, even psychologically, when we break up with an old boyfriend or a job, we do this whole villainizing thing. We're like, okay, it's the devil. And I feel like I do see that a lot when people start to get into natural medicine and alternative approaches. They do start to create this duality and this is the bad guy. And I'm definitely all for there is integration. And I think that's important as a reminder for everyone. If you're in that too, that's part of the journey, maybe of breaking up, until you kind of find the middle ground along your journey. Because I definitely went through that too. So I think there's no need for shame or guilt if that's where you feel you're at or you have that perception. But I'm definitely feel like it's so much more powerful, like you said, to have that integrative approach for sure.
Yeah.
So you spoke about biophotons and were talking to us about those and how that information is integrated into understanding how the treatment system was set up. So I'd love for you to briefly touch on those if you could and how they're connected to the system and maybe how, what a treatment looks like potentially if someone's like, well, I understand the concepts of what Rosemary's saying. How does the esogetic medicine interact with this understanding of biophotons?
Yeah. So biophotons are infinitely fascinating and inspiring to me because we get to the fundamental ground of existence through looking at photons and biophotons. So obviously in ancient systems, mystical systems, we've always had this understanding that Jesus said, I am the light and the way. So we understood ourselves as light bodies. And then in the early part of the 20th century, physicists actually started to study the nature of light. And first, in terms of the macroscopic field, Einstein identified that light acted as wave formations made of particles, and they were called photons. So they started to break down matter, and they understood that atoms are not solid and that they can be broken apart by light. So they started to understand that these photons were the smallest quantifiable particle of existence. So this was in the macroscopic field, and then there's been a whole lot of other researchers like David Bohm and so on and so forth. But in terms of healing, so in the 1930s, Russians physicists began to research activity of photons in the body, and they called them biophotons. And this research kind of died out, but then it was picked up by Fritz Popp in the 1970s. So he was a German biophysicist, and really his biophoton research is the research that Peter Mandel has identified with in terms of creating this system, creating the type of light devices that he uses, and applying that understanding to actual medical interventions or therapeutic interventions. So what Fritz Popp showed was that cells communicate via particles of light. So normal cells emit a steady harmonic stream of photons, and these communicate information between cells. And he demonstrated that this is a faster means of communication than via neural pathways or chemical messages. So this biophoton field actually sets up the information stream in the body. And so the neural pathways and the chemical messages are further downstream in terms of activity in the body. So a biophoton disturbance in the body means a biocommunication disturbance in the body. And there's a very nice quote. I thought I'd read you this quote from Fritz Popp about this. So he said, in terms of healing, the implications are immense. Light can initiate or arrest cascade-like reactions in the cells, and genetic damage can be virtually repaired in hours via faint beams of light. The entire cellular metabolism and communication between cells and cell conglomerates would be impossible without light. So our body is basically a photovoltaic cell that is supplied with energy and information via light. And this is the field of the entire macrocosm as well. So we kind of just merge into that field at that level. So it's quite inspiring information.
Yeah. And it is something that I find, like, again, there's so much talking about in spiritual systems about light. And in general, that's something that we talk about. We know on some fundamental level that we are just light. And I love that the information, the research about the communication. So what you were saying was that light is a faster form of communication than chemicals and releasing hormones in the body that communicates and creates all the other things after that. So that light comes first. And so when that's out of balance, or there's a disturbance in that communication of the light biophoton communication signals, that it potentially then sets up this cascade of other issues down the line.
Yeah. So this is the subatomic layer of our matter at the macrocosmic and at the body level. So when you get things that interrupt that, what they describe it as a coherent field connection. A virus could disrupt that disconnection, but also, deep emotional states. Anything where you start to disconnect from the field. This is why we pray. This is why we do meditation. And you all know, because everybody prays and meditates, that when you do those things, many of your symptoms start to unwind and calm down. So again, you don't have to believe in these things. You want to create experiences where you have a felt sense understanding of it. And then that starts to give you a lot more courage in your conviction around things.
So what are your personal experiences with light and frequency? And how you relate that to your own spirituality and connection? Because there's so many more things we can talk about in regards to light and frequency. And that's exactly what we'll be doing next week in part 2 of the Colorpuncture episode. I go into my experiences seeing energy fields and auras and how that relates to my diving into this amazing modality, as well as me becoming so passionate about the science that Rosemary talks about, and basically giving a language to talk about the things I've seen for my entire life. We'll talk about common diseases and symptoms that colorpuncture can support with healing, and the different screenings and the many different ways that the colorpuncture system uses to assess each client as an individual in order to find the proper treatment. And we'll go into some really great examples of some clients' healing stories and what the future of frequency and energy medicine may look like. And we'll share, of course, how to find and locate a local colorpuncture practitioner near you. Thank you for listening to the Mind Body Detox podcast. We wish you wellness and health in your mind, body, and spirit. And be well until next time, my friends.